Mohammed Musa Abubakar is a radiation therapist from the University of Maiduguri Teaching Hospital, representing the Association of Radiation Therapists.
Good morning, good afternoon, or good evening, depending on where you're looking at this from. So I am Mohammed Musa Abubakar, a radiation therapist from University of Maiduguri Teaching Hospital, and I'm briefly going to talk on the role of radiation therapies in breaching language barrier in communicating with the cancer patients. So it is well known that Africa is the second most largest continent after Asia, and over 3,000 spoken languages. So the shortfall of radiotherapy equipment in Africa necessitates the patient to travel for a long distance in order to gain access to radiotherapy care. And the ethno-linguistic diversity of this continent must be taken into account when communicating with these patients. So as radiation therapists, we are at the forefront of fighting against cancer, and more often we interact with this patient depending on the intent of the treatment, either palliative, radical, with or without hyperfractionation. So our contact is more frequent than any other healthcare provider. And our goal as radiation therapists is to bridge the gap in traditional perspective and evidence-based information by fostering a holistic approach to patient-centered care. Evidence have proved that when patients are treated as partners in their care, significant gains are made in patient safety and health outcome. So there are a lot of misconceptions about cancer in Africa. Most patients feel shy to present cancer involving their private parts due to cultural norms in Africa. Other people think that cancer is as a result of sin or other form of charm, or at times it is even contagious. So it is essential to communicate to these patients that early diagnosis and timely referral are key to effective treatment. So the stigma in cancer patients is a very serious dilemma. It arises from negative attitude toward people with cancer, and due to changes from the ailments or treatments like loss of hair, malodor from fungating tumors, weight loss, and other factors. This leads to discrimination, social isolation, and emotional distress by the patient. So this can be reduced significantly by engaging cancer survivors and also engaging professional interpreters who can bridge the communication gap between the radiation therapists and then the patient. So other key aspects of communication, effective verbal communication, the key components that involve using simple languages that is devoid of excessive medical jargons, as stated by the ICRP, International Commission of Radiation Protection, during the Vancouver Call for Action. So other components of non-verbal communication like active listening, positive body language, eye contact, and then professional touch are key to communicating with this patient. And then the ethical principles of radiotherapy practice should be strictly adhered to, not just to radiation therapists, but other healthcare providers. The principle of beneficence, non-maleficence, autonomy of the patient, fidelity, and justice should be strictly adhered to. So in conclusion, though cancer is no respecter of status, class, language, however, it is curable, it is not contagious, it is not a cause or a death sentence. Our journey towards improving cancer care in Africa requires us to transform the way we speak, the way we think, and the way we act, using a respectful language that is devoid of blame, stigma, and superstition. Thank you very much.
Okay, thank you very much. You really were in line with time, and we appreciate also your contribution, because there's a lot of stigma, a lot of myths, illusions that go on, especially in the cancer setup, because up to now as Africans, we are not used to cancer, and cancer is still, something that is a visitor. And the fact that there are thousands and thousands of types of cancers, it's very difficult to actually even explain to a patient what type of cancer they have, because I believe you can have 5 breast cancer survivors, but each one of them, their cancer is different. Their treatment options are absolutely different. So as we try to navigate and see how best we can break the myths on cancer, break the silence on cancer in a manner and in a language that will be more appealing to the people that we serve, it's going to serve us better. So thank you so much. I have seen that we also have Zambia joined in the call. So we thank you in all the different countries that you're joining us from.